Hi friends, welcome to the Pharmacology Discussions. I am Harsha and today we'll discuss about 5 questions. How protamine is bound to insulin and how does it prolong the therapeutic action? What are the different stages of anesthesia and at which stage surgery is performed? Why chloroform must not be used as general anesthetic agent? Why does nitrous oxide produce violent excitement? What is the mechanism of action of methohexital? Let's start with the first question. How protamine is bound to the insulin and how does it prolong the therapeutic action? Before discussing on the insulin bound to this protamine, I will give a brief idea on what protamine is. Protamine is helpful in the spermatogenesis by making the sperm head condensation and also in the DNA stabilization. If you look at the protamine sequence, this is the sequence in which we can find more of R codes here. These are codes, protein codes coding for the particular amino acid. Amino acid codes. R indicates arginine. So this protamine is very rich in arginine peptide, arginine sequences. Arginine rich peptide is this protamine. Uh, Actually, in the DNA replication, if you see in the somatic cells, the DNA, after the DNA replication, it binds to the histones and it becomes more compact, and these compacted DNA will become like a solenoid loops like this. Solenoid loops are nothing but it is a chromatin structure. So more of these solenoid DNAs will become chromatids. So it will become more compact, which helps in the stabilization. In the same way, this kind of stability is present in the sperm head, but here the histones are replaced with protamines. In the sperm head, you can see the protamine is binding to the DNA, and here it forms like a round toroid shaped, and they are more highly compacted than the histones, and it looks like a toroid shape and in the round donut shaped. And this one helps in the sperm head condensation, and it also helps in the more better thermodynamics, and also helps in the better easily flowing through the liquids, and also helps in the prevention of DNA damage. So protamine is present in the sperm and it helps in this way. Okay, now we know that protamine is binding to the DNA. How is it binding? Protamine is a arginine peptide and is binding to the DNA. In the same way, it also binds to the insulin. Now let's see why how it is binding. Uh, Insulin is a negatively charged peptide. Protamine is positively charged. Now let's see the arginine ones. This is arginine sequence. This is arginine structure in which you can see the amino group present here and the carboxylic acid group and the R group, which contains 3 carbon chain length attached to the guanidinium group. This is the guanidinium group, NH2, NH2, NH. This is guanidinium group, which is responsible for giving the positive charge to the arginine. Because of this guanidinium group, it gives positive charge to the arginine, and arginine is always positively charged in acidic, neutral and basic environments. So this protamine contains more of arginine and it is positively charged, and it binds to the negatively charged insulin with ionic interactions. Here, now let's see how insulin, when it is given directly without any protamine, given to the patient in the subcutaneous tissue. Okay, what insulin is? Insulin is given exogenously to the patient, a diabetic patient who is unable to produce insulin on his own. When insulin is given into the subcutaneous tissue, it should pass from the subcutaneous tissue into the blood circulation to reach the whole body and show its therapeutic action. So when it is given into the subcutaneous tissue, it generally forms hexamers. And this hexamer cannot easily pass through the capillary wall. It should disaggregate into dimers and monomers so that it can go into the capillary wall, through the capillary wall into the blood circulation. But generally it disaggregates very easily, finally, and it can reach the systemic circulation. But what if we can stabilize this hexamer for some more time and release the monomer units slowly so that this will increase the half-life? Here the protamine bound insulin is. Here this protamine, when bound to the insulin, it forms aggregates with the hexamer units itself. More of hexamer units with protamine bound to each other, and they'll slowly release the hexamer, single hexamer unit, and that will release the monomer units, and that will go through the capillary wall and then into the blood circulation. In this way, it can increase the half-life. So in this way, protamine bound to the insulin will increase the therapeutic half-life to the patient. Let's go to the second question. What are the different stages of anesthesia and at what stage the actually surgery is performed? Anesthesia is happened in 4 stages. It starts with the induction, which is stage 1. Here the patient is already conscious. The patient goes to anesthesia first starting with the analgesic condition. He will not feel pain. And this stage of anesthesia is very similar to the condition in the person who is alcohol intoxicated. Why? Because in the alcohol intoxicated person, the person is conscious, but he would not feel pain even though if he just goes and goes against the wall and hit his head, he wouldn't feel pain. And few people are disoriented in this stage as they are very uncooperative at this stage. The next stage is the excitement, stage 2, where excitement is sometimes not is observed when the anesthesia is not given properly to the patient. The main thing which happens is the unconsciousness. Analgesia to the unconsciousness is this stage where this happens. The main thing which we observe is that pharyngeal obstruction is seen in the patient. When the patient's tongue would generally fall back, this would lead to pharyngeal obstruction. Even the patient starts doing some guttural or snoring noises, which we can hear or sometimes we can feel when we touch the pharynx region. And eyelash reflex is not seen. This is one of the observations which we can see and find out that the person is in the stage 2. Stage 3 is the operative phase, where this is the main stage where the surgical procedures are done. Here there is a depression of reflex activity and pupillary dilatation is seen and all the muscles gets relaxed. Sometimes a preoperative assessment is done to the patient when he would be asked to lift his head and lift his hands above his shoulder, and the doctor anesthetist places his hand on the anterior abdominal wall and just finds out uh, uh, how much of anesthesia can be given to the patient by observing the muscle, anterior abdominal wall muscles. So sometimes uh, he would assess how much of anesthesia can be given based on the what kind of reflexes should be avoided. The final stage of anesthesia is the stage 4, which is an overdosage of anesthesia. Generally, this stage is always avoided, and the condition which we can see is the respiratory paralysis in the patients who are overdosed with anesthesia. Muscle relaxants are actually plunged as soon as the patient becomes unconscious to avoid going into the stage 4, so that after the anesthesia, after the and after the stage, after the third stage of the anesthesia, the person would generally become conscious, and then muscle reflexes also can muscles also gets muscle relaxation also can be lightened up. This is a chart in which we can see that there is a different parameters which we can observe in the different stages of anesthesia. In the first stage of anesthesia, the reaction to the pupil is significantly, the pupil size is reduced when the light is given to the eye. And in the second stage of anesthesia also we can see that there is a decrease in the pupil size. But in the third stage we can see that the pupil size is not decreased because the muscles are all relaxed in each stage. And the fourth stage is the completely overdosage of anesthesia. Our next question is, why chloroform must not be used as general anesthetic agent? We know that chloroform is an anesthetic agent. Previously, it was used widely for anesthetic purposes, but later on they came to know that chloroform was not only having the anesthetic agent properties, but also having some of the toxic effects. It has various toxic effects, and it has many effects on other organs like in the respiratory system and also in the eye. It also has embryotoxicity and some of the carcinogenicity, but mostly it affects the three organs, that is heart. One of the organs is heart, in which the chloroform directly stimulates the vagus nerve. We know that vagus nerve is a parasympathetic nerve which acts on the heart. There is a decreased heart rate because of acetylcholine production in the heart, and which has in, a decreased heart rate function, in that acetylcholine has that function on it. So it directly stimulates the vagus nerve, and it shows the cardiotoxicity in that way. Sometimes chloroform directly affects the myocardium also. The other one is the chloroform affecting the kidneys. It has a nephrotoxic potential, especially it affects the epithelial cells of the nephron in the loops of Henle, especially in the nephrons, loop of Henle in the renal tubules. There would be a it affects that area, making it to nephro uh, kidney necrosis. The other one is the liver toxicity. Most of the chloroform, people who work in the industries or who are exposed to most of this chloroform have fatty liver. Even a patient who is undergone with this chloroform anesthesia for at least 15 minutes, we can see there is a fatty infiltration in the liver. You know that fatty liver is not fatty infiltration, nothing but there is lipid deposition in the liver. So deposits of fat in the liver would inhibit the metabolism and also enlarges the liver size. But gradually, when they are not exposed to the chloroform, the hepatomegaly, that is the increase in size of the liver, is decreased again back to the normal state. Generally, when people who are having this fatty liver, and these people are advised to eat food which is rich in carbohydrates and protein, so that they would come back to the normal state in as soon as possible. Uh, in the liver toxicity, there are two biomarkers which can be used to assess whether the person is having liver toxicity or not. Those are SGOT and SGPT. The next question is, why does nitrous oxide produce violent excitement? Nitrous oxide is also known as laughing gas. Nitrous oxide is used as general anesthetic, and also it is used as a recreational drug because of its euphoric effects. Nitrous oxide stimulates the mesolimbic pathway. Mesolimbic pathway is nothing but the dopamine neurons are released from the ventral tegmental area in the midbrain here, and they pass to the nucleus accumbens in the cortex, which is nucleus accumbens is present near the ventral side of the cortex. So this pathway, called the mesolimbic pathway, is also called as the mesolimbic reward pathway, as dopamine helps in the reward is responsible for the reward system. So in this way, it stimulates the mesolimbic pathway, which helps in the euphoric effects. In that way, nitrous oxide would have an euphoric effect. And the other pathway, in which how it acts as an anesthetic, is by blocking the NMDA receptors. NMDA receptors are nothing but the N-methyl D-aspartate receptors. The NMDA receptor antagonists are thought to have anesthetic properties. The drugs like ketamine, phencyclidine, pethidine, nitrous oxide, they all act as an NMDA receptor antagonists. So what are these NMDA receptor and NMDA receptors? These are inotropic receptors, and the some of the neurotransmitters like glycine or glutamate, when they bind to the receptor, the electrical signals would pass through the channel. But if you block it, even by blocking it as competitive antagonist for the glycine or so to the glutamate, the channel gets closed. But how this nitrous oxide blocks this channel is by directly blocking to the channel. It doesn't bind competitively as an antagonist or binds to the as a non-competitive antagonist, but it uncompetitively blocks the channel. Even though the glycine or glutamate binds to the receptor, the channel is blocked with the nitrous oxide, so the electrical signals do not pass. In that way, it acts as an anesthetic. Our final question is, what is the mechanism of action of methohexital? Methohexital comes under the classification of barbituric acids, also called as barbiturates, and methohexital is generally used as an anesthetic, especially when using for deeper sedation. It is mostly used in the settings of electroconvulsive therapy. It is very helpful in that ECT therapy used as an anesthetic, because methohexital, when compared to the other barbiturate anesthetics, methohexital has a very low seizure threshold. In that way, it is used in ECT therapy. And apart from that anesthetic property, it also has a very good recovery after induction of anesthesia. The patient may get recovered in 7 to 10 minutes. Within half an hour, he completely gets recovered. So in that way, it is very good anesthetic agent. So we know that methohexital acts as an anesthetic, but how does it act? Let's just see the structure of methohexital. This is a barbituric acid, and this is a methohexital structure. I'm not going deep into the medicinal chemistry right now. I'm just talking about pharmacology. This is gamma aminobutyric acid, which plays a very vital role here. So, what is this? Methohexital binds to the GABA A receptor. GABA A receptor helps in the passage of chloride channels inside it. GABA A receptor, this is uh, gamma aminobutyric acid, which is a neurotransmitter, which is an inhibitory neurotransmitter. Why is it inhibitory neurotransmitter? Generally, in the intracellular region of the cell, in the intracellular one, there is a negative potential. In the extracellular, there is a positive. When there is more of chloride channels passing into the cell, there is more of negativity, and which prevents the next action potential. So in that way, it inhibits the action potentials. That is why it is called as gamma aminobutyric acid, which is an inhibitory neurotransmitter. It inhibits the neurotransmission. Here, this gamma aminobutyric acid structure is like this. It has a COH group on one side and NH2 group on the other side. That is, okay, let's see. COH on one side and NH2 on the other side. So it looks like a amino acid for me. But it is not an amino acid. Do you know why? Amino acids are alpha amino acids. That is nothing but COH group is present on this side, and the NH2 group would be present on the alpha carbon atom, attached to the alpha carbon atom here. But here, the NH2 group is present on the alpha, beta, gamma position. So this is gamma amino butyric acid. So that is why it is not called as an amino acid. Okay, now this gamma aminobutyric acid binds to the GABA A receptor. Here also, GABA receptors are classified into two types: GABA A receptor and GABA B receptors. GABA A receptors are ligand-gated ion channels, or also called as ionotropic receptors, and GABA B receptors are metabotropic receptors, or G protein coupled receptors. As ionotropic receptors are very fast acting ones, these benzodiazepines, barbiturates, they all act on the GABA A receptors. GABA A receptor, this barbiturates or methohexital, they bind to the GABA A receptor and they allosterically act on the receptor, and it helps in the opening of the channel in which the chloride ions would pass. Here, methohexital helps in the more efficacy of the ion channel opening, so that the chloride ions will easily pass. But unlike benzodiazepines they bind to the GABA A receptors and they help in the efficacy of the gamma aminobutyric acid GABA to effectively bind to the GABA A receptor. So that is why barbiturates are much more toxic than benzodiazepines, because it directly opens the channel in which chloride ions would pass. But benzodiazepines, they bind to the site in which it increases the efficacy of the GABA to bind to the GABA A receptor. In this way, methohexital would act on the GABA A receptor. GABA B receptor is also there, which is metabotropic receptor. Only baclofen drug can act on that receptor. Thank you very much for watching the video, and if you have any questions to be discussed like this, please put your question in a comment section under this video. and do not forget to share and subscribe.